Good day to all. This will be a video about breast cancer and cervical cancer, informing you about the causes and symptoms of both, how medical procedures detect early stages of breast and cervical cancer, the ways of preventing these two types of cancer, their treatments, and the impact these two diseases place upon a developing country like the Philippines among the women and their families. What are the causes and symptoms of breast cancer and cervical cancer among women? Women with certain risk factors are more likely to develop breast cancer. Some risk factors can be avoided, such as avoiding drinking alcohol, but most risk factors, such as a family heredity, cannot be avoided. What are its symptoms? When symptoms do occur, it is usually an abnormal lump or mass in the breast, nipple discharge or redness, and changes in the skin such as puckering or dimpling and swelling part of the breast. Cervical cancer is caused by having many sexual partners, smoking, taking birth control pills, and engaging in early sexual contact. Pain in the pelvis, pain during sex, or vaginal discharge that is not normal. When the following symptoms appear, you may potentially have cervical cancer. How do medical procedures detect the early stage of breast cancer and cervical cancer? Breast cancer is sometimes found after symptoms appear, but many women with early breast cancer have no symptoms. This is why getting the recommended screening tests before any symptoms develop is so important. If something is found during a screening exam, or if you have any of the symptoms of breast cancer, your doctor will use one or more methods to find out if the disease is present. If it is found, other tests will be done to determine the stage of the cancer. The first step in finding cervical cancer is often an abnormal Pap test result. Cervical cancer may also be suspected if you have symptoms like abnormal vaginal bleeding or pain during intercourse. What are the ways of preventing these two types of cancer? For breast cancer, I advise you do the following. Limit alcohol, don't smoke, control your weight, be physically active. Cervical cancer, get a regular Pap smear, limit the amount of sexual partners. Don't smoke. If you are, quit it, and avoid secondhand smoke. What are their treatments? The main treatments for breast cancer are surgery, radiotherapy, chemotherapy, and hormone therapy. The treatments for cervical cancer include radiation therapy with chemotherapy given simultaneously, radical trachelectomy, chemotherapy followed by surgery. In developing countries like the Philippines, what is the impact of cancer among women and their families? In my opinion, the impact would be staggering. Since this country is still developing, these two diseases on women would put a strain in the working industry and would put a lot of families into a hard situation. In my opinion, the impact would be staggering. Since this country is still developing, these two diseases in developing countries like the Philippines, what is the impact of cancer? I have the cancer, boss. Hey, boss. Yay. In my opinion, the impact would be staggering. Since this time